Please welcome Dr. Leana Wen, the president of the Planned Parenthood Action Fund.
Good afternoon, everyone. Where is my Planned Parenthood family? So I want you all to imagine this. You are in need of urgent medical care. The closest health center, though, is 200 miles away. When you arrive, your doctor tells you that because of state law, she cannot provide your treatment today. You have to come back in 72 hours. So you go home, you arrange childcare and time off from work, and you do this 400-mile round trip again 3 days later. This is the reality of abortion care today in the United States. Today, 6 states have only one provider of abortion left. Last month, Missouri came within hours of losing abortion access entirely. And as we speak right now, there are 15 cases that are one step away from the Supreme Court. If Roe is overturned, then 1 in 3 women of reproductive age, which is 25 million women, could be living in states where abortion is outlawed, banned, and criminalized. Now, you all know that earlier this year, Alabama signed into law the most extreme abortion ban since Roe versus Wade, with no exceptions for rape or incest, that could put doctors in jail for up to 99 years, longer than the rapist could receive. By the way, laws that criminalize doctors have another effect, because to be enforceable, they allow the state to investigate women for having miscarriages. So last week, I decided to write about my own experience with a recent miscarriage. My husband and I desperately wanted to grow our family and to have a sibling for our son, who's almost 2. It was devastating to go through. And I just cannot imagine how cruel it would be to compound the trauma of my pregnancy loss with the indignity of government investigation into my personal medical records. I once treated a woman who waited days before she came to the ER for a miscarriage complication. By the time that I saw her, she was in septic shock, and she almost died. She didn't have health insurance, which is something that no one should face, just as no one should be afraid of being criminalized for seeking medical care. Let's be clear that we are in a state of emergency for reproductive health care in America. And a state of emergency requires an all-hands-on-deck approach. So fellow advocates and activists, we need to act today. We need to be clear that keeping people unhealthy is a tool of oppression. And that stigmatizing sexual and reproductive health care is a tool of misogyny. So as we organize, as we mobilize, as we fight in the courts and in the legislatures, I need your help to do 3 things. First, I need your help to spread the word and speak about abortion care as the health care that it is. One in 4 women in America will have an abortion in our lifetimes. Abortion is part of the full spectrum of reproductive health care, which is health care. And politicians, people don't turn to politicians for advice about cancer treatment. So politicians have no place in someone's personal medical decisions about their pregnancy either. And now second, I need your help to talk about the essential care that Planned Parenthood health centers provide every day. Did you know that other than for the VA, Planned Parenthood is the only national healthcare organization with a presence in all 50 states. Planned Parenthood's over 600 health centers provide primary and preventive health care like cancer screenings, birth control, and yes, safe, legal abortion care, which is health care. And we are proud as Planned Parenthood to serve not only women, but men, LGBTQ people, youth, families, and all people. And did you know, too, that Planned Parenthood is expanding services such as trans care, maternal health, mental health services, which is also healthcare, too. And our doctors, nurses, and clinicians connect patients to health insurance and assist with food and housing needs because that's good healthcare, and that's what Planned Parenthood does. So I need your help to affirm what Planned Parenthood does every day, that sexual and reproductive health care is health care, and that health care must be a human right guaranteed to all, not just a privilege available only to some. So third, I need your help to be bold and to take back the language. We need to call it as it is, that these extreme abortion bans have nothing to do with medicine and science. They have everything to do with power and control over people's bodies. And we need to speak out that choice alone is not enough when that choice is predicated on privilege. And these policies that restrict care, they will hurt those who already face the greatest barriers. It's families with low income, it's people of color, it's immigrants, it's LGBTQ people. So we need to lift up the work of our partners who have led the movement not only for reproductive freedom, but for reproductive justice. Because a right is a right in name only if there is no access, and because nobody is free unless everybody is free. And one more thing, too. These same states that have some of the most extreme abortion bans also have some of the worst health outcomes. Alabama leads the US in cervical cancer deaths. A pregnant person in Georgia is 10 times more likely to die in childbirth than a pregnant person in California. 5 counties in Missouri are facing an 1,000% increase in syphilis. So we need to reclaim the narrative and take back our language. They don't get to call themselves pro-life when they push policies that are taking healthcare away from people every day. They don't get to call themselves pro-life when we are the ones who are providing life-saving, life-transforming care. And we need to say loud and clear that being pro-choice, being pro-reproductive health care means that we are pro-women, pro-child, and pro-family. And we need to be loud and proud that our values are the ones that define America: health, dignity, justice, freedom. So I'm going to end today with a quote from Congressman John Lewis, who said that there is good trouble and bad trouble, and good trouble is when we stand up to injustice. And so friends, colleagues, fellow advocates, now is the time to create good trouble together. We must speak up and fight for sexual and reproductive health care as a right for all. We must be brave, and we must take back the language and the values that belong to us. We must act now. We must stand up to injustice, knowing that we can do better, and we must do better because people's lives and our children's futures depend on each and every one of us. Thank you.